Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullah. We are discussing immotile cilia syndrome, which is known as Kartaganer syndrome. This is basically primary ciliary dyskinesia, that is Kartaganer syndrome, where we see it is inherited as autosomal recessive trait. Patient develop bronchiectasis, sinusitis, and situs inversus. Defect in the ciliary motility due to absent or irregular dynein arm. Lack of ciliary activity interferes with the bronchial clearance, and males have infertility. So we see situs inversus, sinusitis, bronchiectasis, and infertility. Here we can see this is X-ray of the chest PA view, and we can see dextrocardia, arch of the aorta, and the left heart border. They are on the right side of the mediastinum instead of in its normal position. And here we can see barium is noted in the stomach. So it is a typical example of the situs inversus. There is blunting of the CP angles on both sides, and we can see patchy densities are noted along pericardic areas in both lungs, suggesting bronchiectasis. Here we can see this is post-contrast CT examination of the chest, and position of the arch of aorta is on right side. Here we have CT of the chest. This is axial slice, and here we have coronal deformity. We have to see two things. Number one, position of the heart. This is left ventricle, and here we have right ventricle. And here we can see arch of aorta is on right side. Similarly, this is left ventricle, which is on right side, and here we have left atrium. So this represents dextrocardia, number one. And number two, we see there is diffuse dilatation of all bronchi in lower lobe, while there is thickening of the wall of the bronchi, both on axial and coronal images. So this represents bronchiectatic changes. So here we have another example where we can see X-ray chest showing dextrocardia, and on CT we can see inflammatory changes in maxillary sinuses and nasal cavity, while liver is located on the left side, and we can see spleen, stomach, both are located on the right side. So this is situs inversus. And here we can see this is CT chest, where we can clearly appreciate diffuse bronchiectatic changes in lower lobes with tree and bud densities. So this is a typical example of Kartaganer syndrome. This last example where we can see, and this is dextrocardia, and we can clearly appreciate bronchiectatic changes in pericardic areas and lower lobes on either side. Similarly, mild diffuse mucosal thickening is also appreciated, suggesting bilateral maxillary sinusitis. And here we can see spleen is located on right side, and this is liver located on the left side. And here we can see heart is located on right side as well. So this is a case of Kartaganer syndrome. Thank you very much. Assalamu alaikum wa rahmatullahi wa barakatuhu.